What does the end of the pandemic look like, though? Is it just really low death rates? The COVID is amongst us?
That's a really difficult question to answer. So one would be that it starts to be a seasonal virus. Now, it's not seasonal. BA.5 was a global surge. The next variant is likely to be a global surge as well. So you start seeing a pattern evolving where spring, summer, autumn, whatever, different viruses behave in different ways, but you can see that it comes and goes during the year. That's a sign that it's integrating into our environment and interacting with our immune system accordingly. But when we're still vulnerable to an Omicron type situation where it just sweeps all before it, albeit a milder virus against a vaccinated population, then we're still in a pandemic world. And we'll continue to be until we have we have high levels of immunisation around the world, and we've got good controls and monitoring in place so we know when something's coming. But at the moment, if a new variant comes along, we're vulnerable to it in terms of our immune system, and it's more dangerous, in other words, it's nastier, then that's the worry. So until we're out of that, it's going to be hard. But we've got to get the amount of virus in the world down to very, very low levels where it doesn't have the opportunity to mutate into new variants. And there's still a lot of virus around.
Do you agree? The end is in sight?
Well, you can see the possibility of the end being in sight. One hopes that it is. The problem is it's been badly reported, what he said. And he used quite a clever metaphor, which is the marathon. That if you see the finish post in the marathon, you don't start walking, you start running, otherwise you won't get there. And that's what that's what he's saying, is that, you know, here's a lull at the moment. We're coming off the BA.5. Deaths are at an historic low going back to March 2020. Mind you, it comes off very high death rates, high numbers of deaths in Australia, and untold numbers of people yet to be, discovered with long COVID and the after effects and excess deaths to come. But he says there's several things that countries have got to do, including things that we're not doing well in Australia, like testing. Our testing is a shambles. We haven't got an organised testing program. We're relying on people doing rapid antigen tests. We have vaccination. We have low third dose rates and much less fourth dose. And therefore our vaccine coverage is going to go down. We are behaving as though the pandemic is over when it's not. And I think he was addressing his remarks to countries like Australia, we're not alone, in hoping that it's over and behaving as though it is when it's not.
Queen's funeral is coming up, of course, later today, our time. You've been digging into the history of royal health. Latterly, of course, they've been pretty long-lived, haven't they? But they've had issues in the past. They have
had major issues in the past. I don't have time to go into all of it here. We've got a special report tonight on the health report. But nonetheless, George III, they argue that his disease, people might remember The Madness of King George, the movie, contributed to the loss of the American colonies. It turns out to be a rare blood disease called porphyria, and how that concluded we'll talk about tonight. Haemophilia. Queen Victoria, for some reason, we don't understand how, had the haemophilia gene, and she passed it to some of her 9 children. It affected the Spanish royal family, the German royal family, and infamously the Romanovs, where Alexandra, who caught it from Victoria via Prince Alice, and passed it on to her son Alexei, the heir to the Russian throne, brought in Rasputin the monk, hated by the Russian public, created instability, which was already there with the pending Bolshevik Revolution. So these things have enormous implications.
They illustrate bad lifestyle choices, also illustrate the problems that can be caused.
Henry VIII being the
and the Queen's father, I guess, smoking.
Smoking, but also mental health issues, and and he had clearly mental health issues with the stress of taking on this unexpected thing after the role after the abdication. So mental health issues are also really important. But we've had this period of stability, and they're clearly a long-lived family. Whether that's through privilege and good medical care will yet to be seen. But I think King Charles will live a long time.